Sure. So my name is Zahin. I'm a PGY2, a second year resident. I am a radiology resident in upstate New York. So that's what I'm doing right now. I went to medical school in Michigan, and then I moved up there for residency, basically.
So what made you choose radiology as your specialty?
That's a good question. I think radiology is like a hard specialty to like a lot of people when they're growing up, they want to be doctors, and they decide upon a specialty pretty early, even if they don't say so, like cardiology or what have you. Radiology, I think, is a little bit different. I think people decide a little bit later when they kind of interact with it a little bit more. For me, I was really interested in sort of like diagnosing more than maybe other parts of medicine. Medicine is a lot of things. It's treatment. It's talking to people. And then part of that is diagnosing. And so when I was in medical school, I was looking at things like gastroenterology, oncology, things like that, where you get to help a lot of people, and you get to basically have these individuals come from, their primary care doctor or what have you, and they have problems, and you're the person to sort of figure out what their problem is. So I was really fixated on that part of medicine. Probably in my third or fourth year of medical school, I had a rotation with radiology. And you go into this dark room where all the radiologists sit, and they're just sitting in front of their screens and in front of all their imaging. And so, they would have these patients that were also undifferentiated. They had these symptoms, and no one really knew what was going on for a lot of people. And it was your job, or it was their job as a radiologist, to look at the imaging and sort of have a differential or diagnosis based on that. So I thought that was really cool, that they were so involved in the diagnostic process more than anything else. The other thing is, I guess I've always been sort of interested in technology. I've always been sort of like a computer nerd. And so there's nothing more technologically focused than radiology, I guess. You're sitting in front of some of these monitors can be $20,000-$30,000. You're working with state-of-the-art equipment all the time. All the imaging is getting better and better. So I think it's those two things. Three things. I wanted to help a lot of people. I wanted to be involved in the diagnostic process. And then number three is the technology part of it. So if you're super interested in technology, I think that's the field. Those are the major parts of it.
Okay, so for you, what does a typical day as an R2 resident physician look like?
Sure, yeah. So I'm, like I mentioned, I'm a PGY2 second year resident. The first year of residency for things like radiology, anesthesiology, PM&R, dermatology, it's kind of separated. You do your first year usually in medicine or surgery, and then your next years are in radiology. So I'm in the radiology portion of it right now, because I'm in my second year. A typical day I think this might be pretty similar for a lot of radiology residents. A typical day is you wake up, depending on how much you want to study, how naturally intelligent you are, I have to work pretty hard. I wake up at 5:30. I'll study for an hour. So there's question banks that a lot of radiology residents do. There's something called Rad Primer, for example. I'll wake up, I'll do 10, 15 questions, do some flashcards, and then go in for my day. So I live pretty close to the hospital. I commute to the hospital, and we start the day off with lecture. Usually they have an attending physician, someone who's been in the field for decades, who knows immensely more than any of the residents. They'll come in, they'll do a lecture on something. For example, it might be on chest x-rays one day, it might be on abdominal CTs the next day, it might be on certain cancers, it might be on things like that, for example. Yeah. So that's like sort of the beginning of the day. Um, so yeah, so you come in, you get a lecture from an attending, and then you'll start your day basically. Radiology is pretty decent with the hours. It's like 8 to 5, a lot of places, and so like for 9 hours basically you're there. You go into your rotation. It can be like a chest rotation, abdomen rotation, ultrasound, nuclear medicine, things like that. And then you're just getting imaging throughout the day. You're getting calls about the imaging. They're asking about, we see this and this. You guys said this about it. Like, what do you think about the diagnosis? And then, you'll talk to them. You'll get calls from uh, like advanced practice providers. You'll get it from doctors. You'll get it from surgeons. Um, you'll get it from basically everyone, and then you'll get imaging from basically everyone as well. So it's pretty cool. That's sort of how the day goes. You study throughout the day. You read images throughout the day. You do lectures usually at noon. It's a pretty like regimented day. Uh, Call days are a little bit different. Like if you're working nights, then usually those are like nonstop for 11 hours. You're just reading scans, basically. And as a resident, all your scans get overread by an attending. So, you'll read it initially. And if there's any like really important findings, you'll let the providers know. But you'll basically go through the studies with your attending as well. And so that's where the learning comes from up until you're out. It's a 5-year residency. So, yeah.
Yeah.
What would you say has been the most challenging part of your residency so far, and how have you like come to overcome those challenges?
Ooh, challenging. So I guess, there's like a huge learning curve. It's like a crazy learning curve sometimes. Uh, in my intern year, there was a big learning curve, but it's mostly medicine. And as an intern, you're basically, for the most part, there to um, do the things that are told to you by the attending to do. You have these things every day. You have a list you have to check off every single day, and you're working throughout the day to do that. I think radiology can be kind of tough because you're kind of thrown into a completely different world. I think it's unlike any other field of medicine. And getting thrown into that without that much, I don't think anyone has that much background knowledge about the field. So when you get into it, it's really scary actually. You're learning about these new imaging modalities. You're learning about diseases that you never knew existed. You did 4 years of medical school and they're coming up with new disease. Like you're getting told diseases by attendings that you've never heard of in your entire life. You know, it's like a constant learning curve that never ever stops. So I think that's probably the most challenging part of it. I think if you ask people in other fields, they might have different experiences. Radiology is not really that, we don't interact with patients that often. We're usually in the background. And so you might hear different things from different fields in that regard. But for me, it was just like the humongous learning curve. And you're surrounded by like really smart people all the time. So, you thought you had a leg up at some point, but really you're just surrounded by people who are as intelligent or more intelligent than you, and then also incredibly hardworking as well. So, so I would say those two things are the hardest thing is you're constantly struggling to keep up, even if you're someone who was near the top of their class, for example. And then the second thing is the learning curve and learning all the diseases, learning the management, the treatment. Even though you don't need to be really involved directly in them, you still need to know about them. You have to know if you read a certain scan a certain way, what they'll do next, what scan they're going to order next. Are they going to take them to surgery? Is this something the surgeon needs to know about right away? And these are things that you're constantly learning and constantly, making mistakes on too. It's just part of the process. Yeah.
Mm-hmm. So, like, when it comes to, like patients that you deal with on a day-to-day basis, obviously they're going through different experiences. So, like, how would you describe, like, mental health challenges that maybe like you've seen residents residents or patients face during like either or like either side of the spectrum, and like how does that look like?
Yeah. So I guess like I mean I could talk about I think mental health challenges regarding the residents. I think that's a big thing. And then I'll talk about patients as well. Although again, I'm not really patient facing to that extent. For residents, I think a lot of it comes down to one is that a lot of the residents are pretty young, maybe not compared to you guys, but you know they're coming in, they're in their early 20s. A lot of people haven't really they've had jobs, but they haven't had careers. Sometimes you'll meet the individuals who have had careers as well, but I think that's a big part of it. It's like you're in your early life, and you are thrown into a situation where every single decision you make can be life altering for an individual. And then, so it's like high pressure. You're expected to make mistakes, but your mistakes, if you make them, could be life threatening as well. In radiology, we have sort of a buffer, as in like the attendings oversee us, but there's still that pressure that if you miss something, if you miss like a small, a nodule in someone's lungs, for example, that can 10 years that person is going to have to live with your mistake that you made, for example. So that's like I think the pressure is a big thing. Along with that, I'm not in psychiatry, but a lot of like mental illnesses tend to show in the early 20s as well. So you have people that are trying to figure out their early 20s. They're dealing with this high pressure. Sometimes they have mental illnesses that come in during that time as well. I think all of that can feed into a really struggle for mental health. I think all residents at some point feel like burnout to some extent, no matter how supportive their residency is. Like my residency is really supportive, but regardless, it's just like the pressure will get to anyone. We're not superhuman. So I think that's the big thing. I think burnout's huge. It can be a huge issue with residents. For patients, I think it can be really difficult to be in sort of that position. I personally have never been like a chronic, like a patient who's had a chronic disease or has had to get major procedures done, for example. So it's kind of like a weird thing that you're the person who's treating another person, and you really will never experience what they experience at any time. But yeah, people are coming in worst moments of their entire life. They're enjoying, their life, and then all of a sudden they get hit with this like a crazy moment where an illness just comes in and knocks them down for a long time. Or they're not something I can directly describe, but I'm sure they're not pleasant. And we always try to think about that when we're treating people, or like reading images, even that sort of thing.
Sorry, my friend's little brother is screaming in the background. Sorry, you can continue. My bad.
No, that's good. I'm just making sure there wasn't something on my face.
Yeah, no, he's playing video games and it's...
Oh, video games. That's a great way to ease the stress.
Get out that workload. How would you say in your experience that, like, do you think the culture in medicine encourages or discourages of talking openly about mental health? Like, do you see it often, like, among your own residents or in attendings, or is it more like something that's hidden and not exactly talked about openly?
Yeah, no, it's like a really good question. I think for a long time, I think like historically, from what I've heard through the grapevine, it used to be that it was like completely hidden. People would do their best to hide any mental challenges that they were having, for the fear that if they were treated, that someone would find out. I think that's what it came down to. Over the last few years, at least like while I've been in training and in medical school, there's been a push, and at least through my medical school, to sort of open up a pathway to talk about it. And so you'll see like a lot of medical schools and residencies, they will basically, they have like partnerships with therapists. They'll have, they'll have like pathways that, for example, if you have like a substance use issue, which happens, frequently with medical students, residents, it's just not talked about that often. Then they have pathways where you would just admit it to the program or the medical school, and then you may not lose your license. You just have to go through the things that they require you to do, which is like counseling, certain testing, things like that. And then it's sort of a pathway to get out and into practice without losing everything. So that's like one example. But yeah, I know like my program has mental health counseling. It has, you can take mental health days, and they're not traditional sick days. They're like mental health days. You can have therapists that are contracted with the program, with the hospital, all of these things. And then on top of that, it's like other things as well. Like, you shouldn't be treated like a cog in the machine. And so if you're at a good program, they will also let you go to your doctor's visits and dentist visits, things like that. But I think it's improving, especially like on the, at least like superficially, it looks like it's improving. The only thing I would say is a lot of the people in medicine, they're not individuals who will easily let themselves show any difficulties that they're going through. Yeah, weakness is a good word. Yeah, show any signs of weakness. We're sort of expected to be very stoic, and because we're interacting with patients, and if you show too much emotional lability, then you don't want them to lose confidence in you, for example, and your treatment plan, your diagnosis. So I think the people oftentimes, there's like a subculture of medicine where you're expected to not show anything, show any signs of mental quote unquote weakness, for example. So I think that is still an area where we need to improve on. You won't see people admit very often that they're on like SSRIs for depression or anxiety, things like that, within your own program or that sort of thing. So I think superficially it's like improving. I think it's like the undercurrent subculture is a little bit more difficult to say. Yeah, from my perspective.
So like considering mental health and like what steps you would need to take as a resident, like what strategies like do you think you've employed to help manage your stress during residency or any mental health challenges you've faced?
No, I think I've definitely experienced burnout, at least in my intern year, just like with the workload. And so during those times specifically, it can get really hard to like take care of yourself, honestly. Like you could be very consistent with the gym, you could be very consistent with your eating habits, and then all of a sudden you're on 1 month of nights straight where you're working 6 days a week, 12 hours a day, and it all kind of goes through the window, for example. But still, I would say, like, personally, I think the best things that I've done is just like having a consistent gym schedule. Just like consistency, honestly, I think is a word at the end of the day. Even when it's really hard to, just being consistent with everything. So going to the gym, hanging out with family and friends. I'll like FaceTime my friends, not while driving, allegedly. Daily, friends and family. And then eating is huge too. If you let yourself, you'll be eating at the hospital every single day. And if you don't have a stipend, that's like a financial issue. And then on top of that, you're not going to get good, like healthy food there. You're going to be getting fries and a burger, like every single day, or getting DoorDash every single day, to the point where you're on a first name basis with a DoorDash driver. So you know you're very deep. So I think consistency is like the main thing. And then, yeah, I think that would be, I think the most important thing. And then also knowing when you're starting to burn out a little bit. It can be hard because you're just like, why am I sleeping 10 hours a day? Like I was sleeping 8 hours a day before this. Or like, why am I not keeping up with certain things? I think acknowledging when you're starting to feel different than your baseline is huge. And then taking steps to act on it. And if you're too far, if you're too far gone to make sure you're looking to professionals for help, regardless of what you feel what the consequences of that would be. Reaching out to psychiatrists or therapists and things like that are really important. I think people going into residency, they should try to get their try to think about this. People going into residency should, if they feel like they need help, get it before they get into residency, because it's a lot more difficult to be consistent with like counseling sessions, interacting with like a psychiatrist or therapist, things like that. Definitely try to get that figured out before residency, before like these big events, before getting into medical school, before getting into residency, things like that.
I do have a question based on one thing. I know your siblings have followed the pursuit of medicine. So did you also feel like did that inspire you, or is it on your own self that you decided you wanted to pursue that?
No, that's it's a hard question. I'd like to think it was all on my own. Like I'd like to think that I was like MacGyver and like decided that on my own, in my own independent thought, that I wanted to go into medicine. But I think it's hard to say that. I think going into medicine's a decision that is, a lot of it's very personal. Like, deciding that you want to help people and this is like a profession that you want to do. That's like a big question to answer. You have to decide on your own. Mm-hmm. But yeah, I think definitely I was, whether I admit to it or not, I think a big part of it was that like my siblings went into medicine. I'm not going to deny that. And plus you get to see sort of the difficulty and the discipline they have in the profession. And that's something that you end up wanting to strive for at the end of the day. So I think it's a little bit of both. I'd like to think I would go into medicine if I didn't have siblings who are also in medicine. We all went into different fields, but I think definitely it colored my perception in a positive way for medicine.
Like another question, like this is just like something like off the top of my head, but like considering that you had siblings, and I know like sometimes like especially like having like influence from your siblings, sometimes there's like pressure. Like did you experience any pressure to like quote unquote live up to like your siblings or something like that?
Oh, definitely. Yeah. There's always pressure. There's always academic pressure, and I think that can be positive a lot of the times. It can also be negative when it gets too heavy, but I think I did experience like a lot of academic pressure. Like, I definitely did not do great in like high school. And I think early college is when I decided like, yeah, you really have to lock in a little bit because this is not going to end well if you're not going to be able to go into what you want to go into if you don't get a little bit more disciplined.
Questions.
Cultural pressures too that isn't really talked about sometimes. As well, and I bet that's different from person to person, and it can be very positive or it can be very negative sometimes. Sometimes it can, I personally think sometimes it can lead to mental health challenges as well. So nothing is really black and white at the end of the day.
Before we end, do you just have like any last things to say regarding your experience or about mental health?
I think mental health is, especially as it pertains to residency, but even generally, it's something that's very personal and it's different from person to person. And I think that it's really important for each individual to know what their normal is, and to understand, or start to understand what their abnormal is, and start to know when their mental health is, they're having some mental fatigue, for example. And I think that can be the start of a process for a lot of people, and it has been for me as well, you know. So that would be, I think, the biggest thing. And then the second biggest thing, or another first biggest thing, is that there's going to be a lot of like societal pressure to hide or keep your challenges hidden and kept to yourself and try to power through it. But I think that can lead to a lot of morbidity in individuals, and people should try their best to, I'm having a tough time with words here, try their best to not judge others for their mental challenges, and also not judge themselves too harshly for their own mental challenges as well, and seek help.
Any more?
No, I think we're good.
Okay, thank you so much. We really appreciate it. It was a great interview.
All right, no problem. I appreciate you guys having me on.